my theme is a little bit offset in glaucoma, but I hope to keep your interest by showing perhaps some common points with retina. So I performed a study in advanced glaucoma patients regarding their quality of life, their daily difficulties in a videotaped evaluation, and in projection in the design of a new device for administrating eye drops. So as we all know, glaucoma is an optic neuropathy which leads to a progressive visual field loss. This decreases quality of life and decreases also the performance of daily tasks. There are many studies which have concluded, which have shown that quality of life is decreased in glaucoma and in daily tasks also. However, in daily tasks, it's only self-reported. It's the patient says, I have difficulty in performing this, I have difficulty in performing that, so there is no objective evaluation of daily tasks in advanced glaucoma patients so far. Furthermore, glaucoma is a chronic treatment, so its compliance is an issue. At the beginning of glaucoma, the compliance of 25% is really low. 1 out of 4 patients perform well the treatment. That is really, really low. Advanced glaucoma patients, they have already, they notice already their difficulties, so they are highly motivated. However, they have more difficulties in self-administration of their eye drops. This leads to an involuntary and unconscious non-compliance. So I intended to build this study to characterize the difficulties in self-administration of eye drops and the difficulties in daily tasks of these patients. And we performed a videotaped evaluation. So as for the self-administration of eye drops, one of the studies, the third study, was performed also in retina patients. As for daily tasks, 0 studies so far have objectively evaluated their difficulties. We intended to search whether there was an association between these difficulties and visual field defects, and eventually built a device for aid. We performed a prospective observational study throughout 5 months with specific inclusion and exclusion criteria. And we performed different methods for data collection. First, the complete ophthalmic evaluation using a standardized and validated formulary in a pilot study, OCT and visual field, a questionnaire subject to pilot study validation, and with demographic data and self-reported difficulties and self-reported compliance by the patient, and we used glaucoma quality of life 15. Then another researcher, blind to previous tests to avoid bias, performed a videotaped registration of standardized tests. The first task was the self-administration of eye drops. The usual glaucoma eye drops for the patient. We allow the patient to perform their usual technique using a mirror, using a chair, using an inclined chair, and we recorded the number of drops and time until success, whether the drop fell or not in the correct place, and if there was eye contact of the bottle, and if the patient knew whether it was successful or not in placing the eye drop. We also analyzed reading ability and the ability of walking in a crowded room. We utilized always the same room with lateral and ground objects, and we recorded whether there was obstacle collision and proprioceptive help. As for walking on irregular floors, we can see there is a irregular floor with a step which is non-visually signalized, and we classify the difficulty. The last tasks were climbing and descending stairs, and we showed a group of stairs without a contrast visual between those steps, and we recorded whether there was difficulties or not. The results are surprising. This is a small study of a patient's mean age of 73 years old, and 68% of the patients reported no difficulty in administering eye drops, but 20% were absolutely unable to put the eye drop. 72% of the patients reported never touching the eye, but only 40% did not touch the eye. The patients reported a high compliance of nearly 97%. So this is one of the most dramatic patients. He is a monocular patient. He's trying to put a drop in his eye. He takes forever, and his drop is going to fall outside the eye. And afterwards, you're going to see that the patient blinks, as he thought that the drop entered in his eye. So this is a nearly blind patient, which is not performing any treatment. It's really a shock. The second patient, basically he does the same thing. However, he has insight and he places the second drop on the spot. The first drop falls outside the eye. So this goes on forever. He takes 34 seconds to put one drop. So imagine if he has 3 drops. And there he goes. And finally outside the eye. This patient is absolutely the opposite. He doesn't want to take any chance. He puts 2 drops outside the eye, he touches with the bottle in the eye, and he puts 11 drops inside the eye. So it really is, oh my God, he just put half a bottle in his eye. So this might raise economical issues. These are also 3 examples of patients touching in the eye with the bottle. The first one is trying to impress me or something because he's rubbing, absolutely rubbing. I don't know how did he not get an ulcer after that. So it is a surprise though. As for reading, there are many studies which show that reading ability is decreased in glaucoma patients, but by comparison with other daily tasks, this was not a huge problem for the majority of the patients. For walking in a crowded room, I must admit that this room was a bit difficult. The next room will be more standardized and easier. Because it really is necessary also to be thin to pass that. Notice please that notice please that he touches with the hands. His hands see for him. His hands do the job for him, and his elbows. I have another patient that says, when I walk in the street, I walk with my elbows. So it's interesting because these patients develop strategies of proprioception help to their decreased vision. As for walking on irregular floors, we had also a marked difficulty with 2 near falls on the step that was not visible. For climbing and descending stairs, only 15% had marked difficulty, and on the picture on the right, we see the strategy of one of the patients. He measures the height of the degree with the foot, so he tells me that he does that every time. So in the associations, it was possible to see that in these advanced glaucoma patients, quality of life was reduced. Worse quality of life tended to be related with worse visual field. However, it was statistically significant only for some variables, and a worse task performance was associated with worse quality of life. As for tasks and visual field, there was a tendency of higher visual field defects associated to higher difficulty in performing these tasks, but this was not statistically significant. 2 reasons for that. One small sample, and 2, this proprioceptive adaptation and strategies make patients perform higher than expected. So eventually, we can perform a new device to help in self-administration of eye drops. So this is the part of one of the difficult parts, which is grant and funds. So we are still studying this part. Ideally, it would have an inclination sensor so that the drop falls only when it is either oblique or vertical, with a sensor also for eye detection, adaptable to different bottle sizes. An information screen we can see with the alarm, remembering the patient that he has to perform the drop with the number of drops and with other data. And of course a data log afterwards for the ophthalmology to check whether the patient and when and how has he performing his treatment. So this is the first design. We can insert the bottle inside eye target and then firmly close it. The patient touches the button, this red button here, so he doesn't have to press the bottle, because these patients have arthrosis, and they cannot perform a lot of pressure to enable the drop to fall. And afterwards, a sensor here detects whether the eye is closed or not to allow the eye drop to fall precisely in the eye and not outside. And then the information is registered. So in conclusion, there are big difficulties for these patients, and unfortunately, they do not have a good insight for that. They do not realize their difficulties. Fortunately, some patients develop good proprioceptive adaptations, so we should teach the other patients their strategies. Family should be involved. Family can help and should be involved in helping administrating the drops, and eventually new devices may also help. So thank you very much.
Is now open for questions. You know, it's kind of interesting. I don't have a sense of how frequent this is in terms of patients not being able to administer the eye drops correctly, you know, and not having an insight into it.
It is really a surprise. The first one to perform a study only about self-administrating eye drops was precisely with Johns Hopkins Hospital. It was published on American Journal of Ophthalmology, and she also performed a lot of video, and it really is a surprise, because us as ophthalmologists, we assume that patients have no difficulties, and when we see a highly motivated patient in front of us, we really believe in him. And it's really a surprise, because he thinks he's doing what's correct, but the results are really different from what we expect.
Mm-hmm.
They have rheumatoid arthritis, some difficulty, neck problems. There are many things.
Right. Right. Because usually, as an ophthalmologist, if you're seeing a patient, you make the assumption that they are successfully administering the eye drop. You don't. It doesn't occur to most ophthalmologists that they might not actually be, successfully getting that eye drop in there. So it's a big gap. Yes.
You know, today, with our healthcare system, they count the number of drops per bottle. And they only allow the patient to refill the drops on a monthly basis. So we frequently find patients coming in after 15, 16 days saying, I'm out of drops. And it's because of what you're saying. They try 2, 3, and 4, and 11 times. Now they've run out of the medication, and they wait till the end of the month to get their drug refill.
Yes.
So there are clues out there that they're not doing it right.
Right.
One drop costs
Much more.
How this sensor checks the eye?
How does it inject the eye?
Sensor.
Well, that part is still in research. Infrared or artificial vision are the proposed mechanisms to whether to check if the eye is there or not. But that is a part that is waiting for the funds, unfortunately.
Any? Go ahead.
Can the data be downloaded to the patient's electronic records so that everybody can see it?
Yes, that part of here, that small part, for example, in micro USB or any other connection for a laptop, is already thought of. That will be interesting, I think.
When you put the bottle inside, so there is no cover.
No, but it doesn't touch the eye. This device does not touch the eye.
No, but then he has to take it out and put the cover back.
Well, that is a part we can add a button here. That's a very good idea. Thank you.
Because when the air sucks in,
Yes.
the germs go.
It's
go
good.
inside.
It's good.
It is very important that there should
Perform
be
an
some system
isolation,
that
yes.
should show this.
It's a very good idea. Thank you.
Or microscopic filter. Yeah. Delivery device.
Yes.